This podcast is recorded and produced on the lands of the Turrbal people. We'd like to acknowledge the traditional custodians of the land and pay respects to their elders, both past and present. Thanks for joining us again on Fertile Ground, a podcast with Dr. Jodika Ruba, where she answers common questions about fertility and the IVF process. Hello, Dr. Ruba. Welcome back.
Hello. Thanks for having me.
Lovely to have you. So today we're discussing Polycystic Ovarian Syndrome, a big one. So can you just run us through what exactly is PCOS and how does it affect fertility?
So PCOS is a very common condition and it can affect a woman's fertility, though not absolutely. And the good news is for women who have polycystic ovarian syndrome, fertility treatment for these women is extremely successful in achieving a pregnancy. So in essence, polycystic ovarian syndrome is a constellation of symptoms, particularly irregular periods or the lack of periods, and therefore the lack of ovulation, which obviously is integral in getting pregnant. And then the other signs may be what we call androgenic signs, or perhaps an imbalance in the hormones that leads to excessive hair, acne, weight problems. So there's a constellation of symptoms and signs that we look for. And the third criteria with polycystic ovarian syndrome is the appearance of the ovaries on ultrasound. So having a pelvic ultrasound, which is relatively non-invasive, can help identify the multiple small follicles at the edge of each of the ovaries. And if we see 20 or more follicles in at least one ovary and we have one of the other criteria, so either very irregular menstruation or no periods, or at the androgenic signs, symptoms or blood test results, then we can say confidently that a woman has polycystic ovarian syndrome.
How often do you have patients who come to you with problems conceiving and determine that PCOS is at play?
I think it's fairly frequently, and I think often these women already know that they have polycystic ovarian syndrome and they have been diagnosed by their GP or by another gynecologist. So I think the awareness around polycystic ovarian syndrome is definitely better than it used to be, certainly better than it was even 10 years ago. And women being more aware of their own fertility are, and I think with the general increase in media and particularly social media, women are more aware that if they are having problems getting pregnant, maybe they should go and be checked out for this particular syndrome. And almost 1 in 10 women may be suffering from polycystic ovarian syndrome. So it's extremely common.
So if you find PCOS in one of your patients, what does that mean going forward in their fertility? What are the treatment options?
So I think, every individual with polycystic ovarian syndrome is different, and it depends on where they've been previously with their fertility journey, how long they've been trying for. Other factors like their age may come into consideration. So looking at the person as a whole and the couple as a whole before deciding what might be the most suitable fertility option for that couple or that person.
If you have PCOS, does it mean that you definitely have to have IVF?
Oh, absolutely not. So there are other options. So after we discuss the medical conditions that may also affect a woman who has polycystic ovarian syndrome, so we do know that it is what we call a metabolic syndrome. So those women are more at risk of things like high blood pressure, high cholesterol, diabetes, type 2 diabetes. And so often what we do is do a medical workup as well before we hopefully help those women forward with a journey for fertility, so trying to optimise their general health and their mental health before we move forward. And there are certainly other options besides IVF. So there are simple medications that can be taken, oral medications that may help a woman's metabolic status. So one of them is called metformin, and it does unfortunately have a few minor side effects, and we start the dose low and increase the dose. This may help a woman to ovulate on their own without the help of any other fertility drugs, and certainly can help also with their blood sugar levels. The second option, which usually is the first line treatment for polycystic ovarian syndrome and women with infertility, is a drug called letrozole. So this is an oral medication as well that we use for a short time during the menstrual cycle to try and bring on ovulation. And this has been shown to be very effective. And if time seems to be running out, or age is a concern, or there are other factors, then certainly IVF is also an option.
Is there anything that a woman can do on her own to improve her polycystic ovarian syndrome? Does diet and lifestyle affect it?
Absolutely. I think that a lot of people who read about polycystic ovarian syndrome may think that there is only one type. So the typical type, particularly as doctors that we think about, are women who have excessive hair, may have acne, and may be quite significantly overweight. So that's not always the case. So there's not always lifestyle factors or dietary issues that we have to address or that will help. And we know that there is no cure per se for polycystic ovarian syndrome. It is about hopefully, if it helps, to lose a little bit of weight. 10% of weight loss in women who are significantly overweight can in itself help those women spontaneously to ovulate. In ladies who have other problems associated with polycystic ovarian syndrome, lifestyle changes may not necessarily be very helpful. So, and many of the women have already tried all of those things before coming to see a fertility specialist.
How does having polycystic ovarian syndrome affect IVF treatment?
That's a really good question. So in some ways, for a lot of couples who come to see us who don't necessarily have polycystic ovarian syndrome, the main issue we grapple with is producing enough eggs through a stimulated cycle, and the opposite tends to be true with polycystic ovarian syndrome. So for those women, they have a lot of follicles waiting to be stimulated, and we worry about those women becoming overstimulated during an IVF cycle. So compared to women without polycystic ovarian syndrome, we'd need to give the ladies with polycystic ovarian syndrome much less in terms of dose of stimulation compared to the other women, and we almost always get very good egg numbers at the time of egg collection, but the challenge in it comes in terms of not getting too many eggs and not making that woman unwell through an elective process. So that is one of the concerns regarding IVF is hyperstimulation syndrome.
And that's something you can monitor being a fertility
Absolutely. And the wonderful thing in recent years about IVF treatment and with polycystic ovarian syndrome is the way we run the cycle with polycystic ovarian syndrome is much less risky in terms of hyperstimulation syndrome because of the type of trigger injection that we give to mature the eggs at the end of the cycle. It does mean we need to freeze the embryos at the end of the cycle and then come back and do a frozen embryo transfer, but it reduces the risk of hyperstimulation syndrome significantly for these women.
So does that mean if you have polycystic ovarian syndrome, you aren't able to do a fresh transfer?
That generally is the rule with polycystic ovarian syndrome. So we do know the one positive thing about delaying that transfer is that frozen embryo transfers, generally speaking, are much more successful, probably because we don't have all of the high amounts of hormone in the background from that IVF cycle. And we also know for ladies with polycystic ovarian syndrome, it is much, much more dangerous for those women to get pregnant if they have hyperstimulation syndrome. They could end up in the hospital being very unwell. So even though there may be a delay with their embryo transfer, overall they will be healthier, happier, and hopefully pregnant.
Does IVF work just as well on women with polycystic ovarian syndrome as it does with women without it?
I would say yes. And as we discussed before, probably better in terms of egg numbers. And that's why we have to be cautious in those women and try and manage expectation. And I think that women in general who undergo IVF treatment are under the impression that the more eggs they get, the better it is, but also that does encompass a considerable amount of risk in terms of hyperstimulation syndrome, which is not a safe situation for a woman trying to have a baby.
So if a woman's taking medication for PCOS, does she actually have a higher chance of falling pregnant with twins or multiples?
That's a good question. So it depends really on the type of medication that they're taking. So if they're attempting to have a pregnancy with an oral medication like letrozole, for instance, compared to the older fashioned medications, so there is a drug that's still around that's not as commonly used called Clomid. And Clomid was also an oral medication used for a few days during the cycle to induce ovulation. And that was notorious for, in fact, there was about a 10% risk of multiple pregnancy taking that medication. And it should have only really been prescribed in conjunction with watching the growth of follicles and ensuring that if that couple was trying to get pregnant, that no more than one egg was going to be released that cycle. But despite this, there have been multiple pregnancies as a result of Clomid use. That is greatly reduced using the newer drug letrozole.
Well, Dr. Ruba, thanks so much for coming and talking to us about PCOS today. Massive topic, and I think we've helped distill some of the important facts down in this podcast.
Thank you. That was great.